Thank you for the opportunity to present prevalence and incidence rates of atrial fibrillation in Denmark from 2004 to 2018 and some methodological considerations. The reported prevalence and incidence rates of atrial fibrillation has been inconsistent among studies, and varying methodology between studies makes comparisons difficult. We aim to assess the cumulative prevalence of atrial fibrillation in Denmark from 1994 and up to 2018. We also assessed time trends in incidence rates of atrial fibrillation in Denmark during 2004 and 2018. And we wanted to assess whether methodological choices influenced our estimates. We used the National Registry data linkage of all Danish residents aged 18 years and older. Data from the cause of death registry, from the National Patient Registry, and from national statistics were linked using the National Personal Identification Number in Denmark. We defined prevalent atrial fibrillation as hospitalization with one inpatient or two outpatient diagnoses of atrial fibrillation. We defined incident atrial fibrillation as the first hospitalization or out-of-hospital death due to atrial fibrillation with no previous hospitalization for atrial fibrillation the past 10 years. We standardized our estimates to the age distribution in the Nordic standard population, and we assessed average yearly change in incidence rates using Poisson regression analysis and adjusting for age and sex. So, prevalence of atrial fibrillation using our case definition was 3% in 2018. Age standardized prevalence was lower, 2.7%, and if using a case definition that was wider, using one inpatient or one outpatient diagnosis to define atrial fibrillation, the prevalence was 3.1%. Age-standardized incidence rates of atrial fibrillation was higher in men than in women, and for both sexes, the incidence rates increased by 1.7% annually up to 2015, after which it declined by 8.5% per year up to 2018. So, to conclude, the cumulative prevalence of atrial fibrillation is currently around 3% in the Danish adult population. The incidence rate has declined steeply since 2015, and our estimates are influenced by methodological choices. Thank you for your attention.